This talk is about brain surface. The best way to learn neuroanatomy is in the lab. Second best is drawing. At least it is so for me. In this talk, I will combine drawing and questions in the hope that this combination will make memorization easier. For this to be so, you need to sit with a paper in front of you and follow visual clues and audio instructions and draw the brain as clues and instructions are presented. The first question is, which of the following lobes cannot be seen by looking at the lateral surface of the brain? A. Temporal, B. Frontal, C. Limbic, D. Occipital. This is the lateral or superior lateral view of the brain surface. I will start drawing and labeling its landmarks. Start to the right side of the page and advance the pencil forward. Then bend it down and start going backwards. Pass the line where you started drawing. Then go up, again passing the starting point, and start bending the line and continue in the same direction till after passing the starting point, and then bend the line down. First softly and then acutely as you start going backwards to meet the original line. The aqua line I have just introduced indicates the dorsal surface of the brain. Now the two lines correspond to the ventral surfaces. Now the anterior surface and now the posterior surface. I am now indicating the frontal pole, the temporal pole, the parietal edge, and the occipital pole. This is the lateral sulcus, named after Franciscus Sylvius Bacon. So we have drawn the superolateral surface of the brain and will proceed to label the sulci. On the dorsal surface, about halfway between the occipital and frontal poles, a little towards the occipital pole, draw a line slanted forward. This is the central sulcus. Go a bit in front of that one and draw a parallel line to the one you have just drawn. This is the precentral sulcus. Then move the pencil close to the frontal pole and draw a line towards the precentral sulcus, but slanted up at the end. This is the superior frontal sulcus. Go just below and draw a similar line. This is the inferior frontal sulcus. Now go to where the frontal pole and the temporal pole meet. Draw a short line going up and forward. That is the anterior ramus of the lateral sulcus. Go a bit back and draw another line just about the same size but slanted backwards. This is the ascending ramus of the lateral sulcus. Now go to the back of the line and draw a third line going up. This is the posterior ramus of the lateral sulcus. Now go back to the central sulcus and just about the same distance as the precentral sulcus is from the central sulcus, draw a similar line. This is the post-central sulcus. Now, on the line we have just drawn, go 1/3 from the top and draw a line following the parietal edge or border. This is the intraparietal sulcus. At the level of the end of the intraparietal sulcus, on the parietal edge, draw a short line perpendicular to the postcentral sulcus. This is the little bit of the parietal occipital sulcus you can see on the lateral surface of the brain. Now go below the lateral sulcus or fissure close to the temporal pole and draw a line following the lateral fissure but slanted up at the end. This is the superior temporal sulcus. Now towards the temporal pole again, but below the superior temporal sulcus, draw a similar line. This is the inferior temporal sulcus. Now go to the ventral surface about 1/4 of the distance from the occipital pole and draw a short line in the direction of the parietal occipital sulcus. This is the preoccipital notch. Go just above the preoccipital notch towards the occipital pole and curve a line first towards the occipital pole and then up following the edge of the occipital pole. This is the transverse occipital sulcus. So we have drawn the sulci of the superolateral surface of the brain. And we're ready to talk about lobes in this surface. So go to the just completed figure and find the central sulcus and the lateral sulcus. Draw a line from the bottom of the central sulcus to the closest point of the lateral sulcus. In front of it is the frontal lobe. Now go to the parietal occipital sulcus and the preoccipital notch. Draw a line between them. Behind is the occipital lobe. Now go to the end of the lateral sulcus, just before the posterior ramus takes off, and find the parietal sulcus. Draw a line between them. On top is the parietal lobe, and below the temporal lobe. So the answer to this question is C. Next question. The circular sulcus is at the line of reflection between the insula and the overlying opercula. A true, B false. This is the lateral view of the brain. If we separate the temporal and the frontoparietal edges of the lateral sulcus, we find the insula. The anterior upper edge is called the frontal operculum. The posterior superior edge is called the parietal operculum. And the inferior edge is the temporal operculum. I will use this specimen to simulate a dissection aimed at viewing the insula. The unshaded area will be removed, and now you will see the insula behind. This is the sulcus centralis of the insula. This is the limen of the insula. In front of the central sulcus of the insula, we have the short gyra of the insula, and behind the long gyra. This is a much poorly dissected specimen, but the circular sulcus can be better appreciated. Pierre Gratiolet considered the insula to be a cerebral lobe. So the answer to this question is A. Next question. The planum temporale is located close to the anterior margin of the Sylvian fissure. A true, B false. Again, we are looking at the lateral surface of the brain and operculi. The arrow is pointing to the temporal operculum. As you can see in this specimen, this is the insula, this is the superior temporal gyrus, this is the transverse sulcus of the temporal lobe. Anterior to it is the anterior transverse temporal gyrus, and behind the sulcus, the posterior transverse temporal gyrus. The anterior transverse temporal gyrus lays horizontally, so its surface can be seen well from this view, but the posterior transverse temporal lobe is inclined and it is much more difficult to see. They form the planum temporale, a left-sided cerebral structure in most individuals. This drawing highlights the difference between the right and left hemisphere transverse temporal gyri. The left side is big. The same area on the right is small. So the answer to this question is false. Next question. The triangular part is in the A. superior frontal gyrus, B. superior temporal gyrus, C. inferior frontal gyrus, D. occipital temporal gyrus. Here we are looking at the superior lateral surface of the brain. In it, I have just labeled the frontal lobe. In the frontal lobe, we can see the superior frontal gyrus, the middle frontal gyrus, the inferior frontal gyrus, and we find in front of the anterior ramus of the lateral sulcus the orbital part, behind the anterior ramus of the lateral sulcus, and in front of the ascending ramus of the lateral sulcus we have the triangular part, and behind the ascending ramus of the lateral sulcus but confined to the frontal lobe we have the operculum part. In the frontal lobe we can also find the paracentral gyrus. In the parietal lobe we have the postcentral gyrus, the superior parietal lobule. The use of the term lobule to refer to this area and other area is primarily based on tradition. The inferior parietal lobule is divided by the posterior ramus of the lateral sulcus. Crowning the posterior ramus of the lateral sulcus is the supramarginal gyrus. Behind it, we find the angular gyrus. In the lateral surface of the temporal lobe, we find the superior temporal gyrus, the middle temporal gyrus, the inferior temporal gyrus. The lateral surface of the occipital lobe is occupied by the occipital lateral gyrus. So the answer to this question is C. Next question. The collateral sulcus is in the A. insular region, B. frontal lobe, C. parietal lobe, D. temporal lobe. This is the mesial inferior surface of the brain. The cerebellum and most of the brainstem has been cut off. I will now proceed to drawing the mesial inferior surface of the brain. We start close to the middle of the page and draw a line downwards. and forward, curving it up, and then turning the line backwards. The line is then continued in the same direction for a while, and then start going down to just below the level of the original horizontal portion of the line. And at this point, direct the line forward and a little up, then forward and a little down, and then advance the line to meet the original line as you see in this frame. In this frame, at this point in the drawing, you can see the frontal pole, the posterior border of the frontal lobe that can only be seen in the mesial surface, as shown in this specimen. The temporal pole and the occipital pole. So we have drawn the mesial inferior surface of the brain and will start drawing the sulci present in the surface. So in this figure, we will start in the anterior region of the frontal lobe at the level of the tip of the temporal lobe. From there, we draw a line going upwards, following the edge of the frontal region, and then backwards till about a third of the way to the occipital pole. This is the cingulate sulcus. Then go back to the line representing the cingulate sulcus and draw a line going up, not quite touching the upper edge. This is the marginal sulcus. Just in front of it, make a little line going downwards and slightly forward. This is the mesial extension of the central sulcus. This sulcus does not reach the cingulate sulcus. Now go behind the marginal sulcus at the corresponding level with the cingulate sulcus and draw a short line backwards and then downwards. This is called the subparietal sulcus. Now go back towards the occipital pole about halfway from the marginal sulcus and draw a line slanting it forward, but stop before reaching the lower border. This is the parietal occipital sulcus. Now go to the occipital pole and draw a line going towards the parietal occipital sulcus, as you see, and then bend it forward to join the parietal occipital sulcus. This is the calcarine sulcus. Now go to close to the lower edge, a bit over halfway between the occipital pole and the end of the parietal occipital sulcus, and start drawing a line going forward. Continue it, curve it following the lower edge, and then turn it up. This is the collateral sulcus, and the curved part anteriorly is called the rhinal sulcus. At about the middle of the collateral sulcus and just above it, draw a line going forward and again curve it up and then back, and continue the line in the backward direction and slant it up till about the lower end of the subparietal sulcus. Then turn it up towards the cingulate sulcus, then forward and continue it, following the cingulate sulcus. And as the cingulate sulcus curve backwards, do so with this line. And continue it backwards to join the posterior border of the frontal lobe. This is the sulcus of the corpus callosum. This is the hippocampal sulcus. Then go to the ascending portion of the hippocampal sulcus, specifically where the horizontal portion and the ascending portion meet. And starting there, right on the ascending portion, draw a succession of little bumps till you reach the end of the slanting up line. This is the dentate gyrus. Then go below the anterior region of the sulcus of the corpus callosum and draw a band going backwards till reaching the top of the dentate gyrus. This is the corpus callosum. Go just behind the anterior tip of the corpus callosum and draw a short line slanted backwards. This is the anterior commissure, which interconnects the anterior part of the temporal lobe. Go in front of the anterior commissure and draw a thin line going down. This is the lamina terminalis. Just below the lamina terminalis, draw a line going backwards. This line represents the nasal fiber crossing at the level of the optic chiasm. So the answer to this question is D. Next question. The anterior region of the paracentral lobule is in the A. limbic lobe, B. frontal lobe, C. parietal lobe, D. temporal lobe. Now we're going to start talking about the lobes of the mesial inferior surface of the brain, which we have already briefly mentioned. Now we are looking at the mesial inferior surface of the right hemisphere, as we have been doing for a little while. This is the central sulcus, and the sulcus I have just labeled is the cingulate sulcus. A straight line between the central and the closest point of the cingulate sulcus constitute the posterior edge of the frontal lobe in this view. The lowest part of this lobe is the rectus gyrus. The orbital gyrus is lateral to the rectus gyrus. The gyrus above is called the superior frontal gyrus. The posterior part of the frontal lobe behind the superior gyrus is called the anterior region of the paracentral lobule. The anterior portion of the paracentral lobule and the superior frontal gyrus often melt into each other, and it is not possible to say when one starts and the other one ends. So the answer to this question is B. Next question. Which of the following sulci do not abut with the parietal lobe? A. Paraterminal sulcus, B. collateral sulcus, C. cingulate sulcus, D. central sulcus. Again, we are looking at the left hemisphere lateral surface. The arrow is indicating the parietal lobe. In this view of the right hemisphere mesial inferior surface, the one we have been using, I have colored the frontal lobe. Now I have colored the parietal lobe. The parietal lobe is behind the central sulcus, above the cingulate sulcus, and the subparietal sulcus. The parietal lobe in the mesial surface extends all the way down to the collateral sulcus. Bound posteriorly by the parietal occipital sulcus, the parietal lobe in this view is divided by the marginal sulcus. Anterior to the marginal sulcus, we find the posterior region of the paracentral lobule. The area behind is called the precuneus. So the answer to this question is A. Next question. The lingual gyrus is ventral to the cuneus gyrus. A true, B false. This is the mesial inferior view we have been working on. I have now colored the occipital lobe, here indicated by the arrow. In the mesial occipital lobe surface, we can see the calcarine sulcus. Above the calcarine sulcus is the cuneus. Cuneus means wedge. And below, the lingual gyrus. Some authorities thought this area looked like a tongue, and that's why they call it so. Anterior and inferior to the lingual gyrus, we find the collateral sulcus, which also serves as the superior boundary of the occipito-temporal gyrus. The occipito-temporal gyrus is called so because part of it extends in the occipital lobe and part of it extends in the temporal lobe. This is also called the mesial surface of the inferior temporal gyrus. So the answer to this question is true. Next question. The uncus and the parahippocampal gyrus are in the occipital lobe. A true, B false. As we have pointed out so many times, this view represents the mesial inferior surface of the right hemisphere. I have now colored dark yellow the limbic lobe. Anteriorly, we have the cingulate gyrus, which extends all the way to the back, and going towards the front all the way down to the posterior border of the frontal lobe, which we had indicated in the past. This area is called the subcallosal area. A little behind it, we have the paraterminal gyrus, and in the temporal lobe, the parahippocampal gyrus. And a little above, in this view, we can see the uncus. Behind is the isthmus of the limbic system. What is interesting, but not unsuspected if we think in biological terms, is the arrangement by which these areas connect. The paraterminal gyrus and the uncus and the hippocampal gyrus connect by going around the corpus callosum in a bundle of fibers called the cingulum, instead of taking the shorter, more direct route to each other. So the answer to this question is B. Next question. How many lobes can be seen in the mesial surface of the brain? Counting the limbic lobe in the mesial aspect of the brain, we can see 5 lobes. Not counting the limbic lobe, that is incorporating it into the other lobes, we obviously have 4 lobes. The number of lobes is controversial because different authorities in the field of neurology have said different things. Dr. Arnold described 4 lobes, named as you can see in this frame. Later, Dr. Gratouillet described 5 lobes, and Dr. Gassi 6. So the controversy stands, but we're certainly that there's not one lobe, there's certainly not 3, and not 7. Yet, even about this, the literature is confusing. You will see why in the next few minutes. I will use this drawing of a fetal brain of about 4 months gestational age, where, in addition to the structures identified in the picture, you can see the gyrus olfactorius medialis, the gyrus olfactorius medius, the gyrus olfactorius lateralis, the ambient gyrus, and the semilunar gyrus. I would also use this picture to say the last points I want to make regarding the number of lobes in the brain. These points are that you may find the terms olfactory lobe and piriform lobe in the literature. The term olfactory lobe is only used in embryology. The term piriform lobe is still in use in general neuroanatomy, despite the incongruity of having a lobe, the piriform lobe, as part of another lobe, either the temporal or the limbic lobe. So the answer to this question is 5. Next question. The rhinal sulcus is in the frontal lobe. A true, B false. So now we're going to draw the inferior surface of the brain. We start a little to one side in the middle of the page and draw a line up, and then curve it down and slightly in, as if to make a heart. As you can see now that I started going backwards, I continue in this direction as if we were going to finish the heart figure, but before doing so, turn the line straight backward and then continue the line backwards for a relative short distance and bend it downwards, sort of making a U-turn, and start going forward. Continue in the same direction almost to the bottom of the page, and then start going up, thus drawing a more steep line, creating like a little indentation, as you can see, and then continuing the line forward in a more gentle curve up. I do this to about just below the midline and start going backwards, then make a quick and tight U-turn and move the line forward, and then bend backwards and try to make a symmetrical structure to the one on the other side, as you can see here. This is the frontal pole, this is the occipital pole, this is the anterior aspect of the medial longitudinal fissure, this is the posterior aspect of the medial longitudinal fissure. Once the borders of the inferior surface are drawn, we start drawing the sulci. Start on the lower bump of the heart figure at about the middle and draw 2 little bumps, slanting them in the anterior inferior direction while advancing towards the edge of the brain. Then turn towards the back to join the little indentation in the lower margin. I added shadow in front of the line we have just drawn to indicate that the just built structure is closer to the field of vision than the structure anterior to it. the structure we have just drawn is the temporal pole, and the little bump on the side in this view is the uncus. Now go to the back about 1/4 the distance to the occipital pole and draw a line going towards the temporal pole, but do not quite reach it. This is the occipital temporal sulcus. Go back again almost to the occipital pole. Draw a wavy line first going towards the figure resembling the heart, then following the figure's contour at a distance to reach the point between the temporal pole and the uncus. This is the collateral sulcus. The most anterior segment is the rhinal sulcus. Now go back to the edge of the drawing just below the point we started to draw the collateral sulcus, and draw a little line going upwards. This is the preoccipital notch. Now place the pencil a little below the quick and tight U-turn and draw a line forward. This is the olfactory sulcus. This sulcus is usually covered by the olfactory nerve. Go a short distance inferior to that line, closer to the uncus, and draw a short line going forward. And do the same just inferior to it in this page, as you can see. Then go to the middle of the upper line and make a line going down as to draw a lying down edge. These sulci are the orbital sulci. Now go to the other side, close to the upper bump of the heart figure, and make little dots going all the way to the other side. This is the posterior perforating substance. A bit anterior and above the midline, draw a small circle. Then go to the other side and do the same. These are the mammillary bodies. They are the home of the mammillary nuclei. Just between and anterior to both, draw an oval structure. This is the tuber cinerum, home of the arcuate and ventromedial hypothalamic nuclei. And just anterior we have the infundibulum, which is the stalk that connects the hypothalamus and the posterior pituitary. Go a bit above the infundibulum and draw a bunch of dots. Then extend them to the other side. This is the anterior perforating substance. This is an important area because of all the structures that are deeper into the brain in this area. So the answer to this question is B. Next question. The gyrus rectus is in the temporal lobe. A true, B false. Once that the sulci of the inferior surface are drawn, we will start labeling the gyra and lobes. So this is the look of the inferior surface. This is the parahippocampal gyrus, occipitotemporal gyrus, also called the fusiform gyrus, or medial occipitotemporal gyrus. This is the inferior temporal gyrus, or also called the lateral occipitotemporal gyrus. Now go to the pre-occipital notch and to the point just at the end of the figure of the heart called the isthmus. The isthmus of the limbic system. And use a rule between them to draw a line. Behind this line is the occipital lobe. In front is the temporal lobe, or the temporal lobe and the limbic lobe according to others. Going with the more traditional labeling, we're going to continue calling it the temporal lobe. Now go to the anterior aspect of the medial longitudinal fissure and go to the middle of the uncus. Draw a line between these two structures. In front of it is the frontal lobe, the rectus gyrus, and the orbital gyra. So the answer to this question is B. Next question. Which function will be affected? A. Vision. B. Hearing. C. Pain localization. D. Speech output. To answer this question, we will look at the brain in three different views. The from above view, the mesial view, and the lateral view. Here, in from the above look, we have removed part of the parietal and frontal lobes, so you can see the transverse temporal gyrus. This is the area for hearing. Hearing is arranged with high tones medially and low tones more laterally. This is a mesial view of the brain. Here I have indicated the calcarine sulcus. It is the area for vision. This is a lateral view of the brain. The area indicated is the area of Broca. This is the brain of one of Broca's patients. He used this patient to describe what was later called Broca's aphasia. The only sound this patient could make was 10, so he used to be called 10 on the ward. This is the brain of the second patient that Broca used for the same description. This patient could only produce 5 words. An MRI of this second patient was many years later done. It revealed that there is a significant discrepancy in localization between the area described by Broca and what we call Broca's area now. Now let's look first at the location of the sensory cortex. Here you can see a brain's lateral surface, and now I am pointing to the central sulcus. Behind it is the sensory area. Here represented is the sensory homunculus against the edge of the coronal cut brain, as would be seen by a cut represented in the lateral view. Notice the distribution of the homunculus, the 4 legs and the foot are in the mesial surface of the brain. The large area devoted to the index finger, and also the large area devoted to the lips. In patients during surgery, we find the sensory cortex using neurological testing. The test consists of placing a strip of electrodes going across the area judged anatomically to be the sensory and motor areas. This is done so to determine certain parameters known to indicate the presence of sensory cortex. In order to perform this test, we do stimulation of the opposite side of the body. These parameters are phase reversal at the sensory cortex, a positive wave appearing in front of the negative wave, and a negative wave being larger than any other wave. Let's look first at the phase reversal. Once the strip of electrode is placed going across what we believe is the central sulcus, a bipolar montage is constructed connecting electrodes in the chain. One is connected with two is connected with three, and so on. Then the opposite wrist, in this case the right wrist, is stimulated, and the waves are recorded as you can see. Notice that waves in 5 to 6 derivation and 6 to 7 derivation have a negativity on electrode 6, and that the location of electrode 6 is behind what we thought was the central sulcus. So we at least for now consider that area of the cortex where the phase reversal took place to be the sensory cortex. Once we determine the phase reversal, the next thing we do, we look for the positivity in front. Here we do not use a chain montage, but each electrode in the strip is connected to another electrode placed at the right ear. In this frame, the connection between electrode 1 and the right ear and 2 on the right ear are omitted based on the finding of phase reversal on electrode 6, as we have already mentioned. Then the right wrist is stimulated and the waves recorded and analyzed. Notice that the derivation 5 to right ear was positive at 5, and the derivation 6 to right ear was negative at 6. Thus, the positivity is on top of electrode 5 and the negativity on top of electrode 6. So the second criteria is met, and we move to the third criteria, negativity biggest. Using the same montage as we used for testing the second criteria, the waves are analyzed, and as you can see, the negativity is the biggest wave, thus confirming the location of the sensory cortex. By fulfilling the last criteria, we can determine that we are actually looking at the sensory cortex, and in front the central sulcus, and just in front of the central sulcus is the motor cortex. This is a representation of the motor homunculus. Notice the position of the foreleg and foot in the mesial aspect of the hemisphere, the large area devoted to the thumb, and the small area devoted to the lips. So the answer to this question is A. This concludes our drawing of the surface of the brain. Thank you very much for your attention.